Hi, everyone. Welcome to the afternoon session on research tools. I'm Lee Neptune, and I am a PhD student and graduate research assistant with Dr. McNamara at the University of Maine, and I'll be moderating this session this afternoon. So if you have any questions throughout the session, please put them in the Q&A tab over in the chat. Today, we have presentations from Dr. Sarah Colby from the University of Tennessee in Knoxville and Dr. Chelsea Allison from Springfield University. Dr. Colby is a behavioral researcher with a focus on health communication through novel nutrition education strategies. She received her doctoral degree in nutrition from the University of North Carolina at Greensboro. After finishing her PhD, she worked as a nutrition research scientist for the USDA ARS. She has also worked as an assistant professor in the Department of Nutrition at East Carolina University before coming to the University of Tennessee in 2011. At the University of Tennessee, she is the director of research on eating and activity for community health lab with adolescent populations ages 9 to 19 years old. So now I'll hand it off to Dr. Colby.
I'm going to talk about the College Health Programs and Activities Survey. So the goal of this project was to develop a tool that could be used to document the activities, programs, and policies that occur on a college campus. In general, this is still around those same three pillars that you've heard us talk about a lot throughout the different tools of food, physical activity, and stress. So where this came from, this is a very different background of how the tool was developed. We were working with the Partnership for a Healthier America, or PHA. At the time, they had the Healthier Campus Initiative, which was a program they had to try to promote health on college campuses. And they did provide participating campuses with benefits and resources to help those campuses promote health. But they also asked their college campus partners to adopt specific guidelines. And those guidelines, again, were around food and nutrition, physical activity, and programming. When they spent a lot of time developing those guidelines, and they had a panel of experts, and then they had that verified independently by a third party to make sure that the guidelines were appropriate and well developed. So we did not go through the typical development and validation process for these questions, because what we tried to do is we took all of the questions that had been created and developed and tested by PHA and HCI, and we just turned those into a question form, and you'll see how simple that question form actually was. So you'll see why it did not need to go through additional testing. So some of the things to note about if you're using this tool is that it is made to where multiple campus representatives might need to fill it out. It's similar to the points audit and the Healthy Campus environmental audit, where you might need different people with different perspectives to be able to complete that process. So you can complete it over time, not at just one time, but you can come in and out of that survey as needed. There are no individual identifying behaviors being assessed in this at all. And we do collect the email addresses and names of the representatives only so that we have record keeping if we need to get back in contact with some correspondence to clarify some answer. This is what they would see. So I'm going to go over the types of points. And as I go over these, think about whether or not these are things that you already know are happening on your campus. So we ask people when they complete this tool is to please select all of the following you are currently providing on your campus. It could be offering wellness meals at every meal in dining venues across campus. It could be offering a variety of fruits, vegetables, whole grain products in dining venues across campus. It could be offering a total number of fried foods in each dining hall that does not exceed the total number of platform stations in the dining venues across campus. Offer and identify healthier at point of presentation desserts that have less than 150 calories per serving. Also, are you ensuring that the percentage of healthier beverages purchased in dollars is a minimum of 60%, very specific, of total beverage purchases in dollars? So that gives you some ideas. Here's some more that are still around that food and beverage idea. So identify food and beverage items using one of the following strategies. So are you labeling foods and beverages and items offered with calories per serving at the point of presentation, or are you designating healthier food and beverage options using some sort of healthy icon at the point of presentation? Are you implementing a comprehensive strategic product placement merchandising program policy to encourage healthier food consumption? Do you offer a comparable plant-based food option at platforms that serve meats? Are you implementing a local food procurement program that increases procurement of local and sustainable foods? Are you offering tray-less dining in the default system in dining venues? Do you provide healthier vending options on campus by ensuring that at least 50% of your vending machines offer only healthy food and beverage products, or that you have 50% of each vending machine containing healthier food and beverage products? Do you provide healthier catering services on campus by developing a healthier catering menu that incorporates a variety of fruits and vegetables, 100% whole grain products, and no more than 2 fried items on that menu? Do you ensure that the percentage of healthier beverages purchased in dollars is a minimum of 60% of total beverages purchased in dollars for catering? Do you make free water available in all dining venues and all educational physical activity facilities? Do you make available a registered dietitian nutritionist for personal nutrition assessments and counseling to all students? Do you provide marked walked routes on campus with at least 2 miles in length that have distance markers at regular intervals? And do you ensure that a route map is made available to individuals on campus? Do you post signage at each designated or marked crosswalk on campus requiring cars to stop for pedestrians? Do you provide at least 1 bicycle parking space on campus for every 15 individuals on campus? Do you offer a bicycle share rental program or subsidized bicycle purchase program for all students? Do you provide designated bicycle lanes on major roads and/or offer off-street bicycle paths throughout campus? Do you implement a bicycle and pedestrian accommodation policy and/or participate in a national bicycle or pedestrian recognition program? Do you implement a campus-wide program policy that incentivizes the use of public or campus-provided transportation? Do you provide without a user fee 16 hours per day access to at least 1 fitness recreational center for all students? Do you dedicate at least 75% of the primary campus recreational center floor space to areas for physical activity? Do you offer a minimum of 40 diverse, non-competitive, and competitive sports, group fitnesses, intramural, informal recreation opportunities each academic year? Do you offer without a user fee a minimum of 1 monthly how-to or beginner physical activity movement classes that introduces students to new activities? Do you offer at least 1 organization and facilitated 15-minute physical activity movement opportunity break on each school day? Do you offer without a user fee both fitness and recreational center orientations during the first semester for all incoming students and 1 fitness assessment to all students each academic year? Do you provide at least 1 outdoor running, walking track that is open and available for use to individuals on campus and at the community for at least 3 hours per day? Do you provide an outdoor fitness system? Offer at least 1 free organized and facilitated outdoor physical activity movement opportunity each week? Offer a rental outdoor recreation equipment program for students? Offer 20 outdoor recreational clinics or trips during each academic year? Make available certified personal trainers for all students. We're almost done, I promise. Implement and integrate a comprehensive wellness program for individuals on campuses that is provided annually. That it meets at least quarterly. Activities hosted by the Wellness Committee should incorporate provisions for individuals with disabilities. Do you implement a mandatory health and wellness education online module to be completed by all incoming first-year or transfer students upon registering with the college or university? Do you implement a program policy that identifies students who may be food insecure and provide options on campus? Do you implement a program policy that supports and accommodates breastfeeding for mothers on campus? Do you implement a service learning program available to all students that focuses on food, nutrition, physical activity, movement, and/or coaching? Do you offer rewards on benefits structured program that gives insurance premium discounts or rebates to individuals on campus who participate in a wellness program? Do you offer in-person non-academic cooking skills classes that are available to all students and incorporate fruits and vegetables? So you can see that was a lot. I hope that you took the time actually to listen. I know I was reading a lot, to think about how many of those things are offered on your campus. And I hope you could use this tool, similar to how PHA originally intended, that it will help you pick some things you might want to target that you're not currently doing. And I'll give you some evidence for why that might be a good idea in just a moment. So you can use that tool to identify areas that you might want to try to put into place over a certain time period. And then it also gives you a chance, if you use the same tool over and over, to track to see what increases you've had on campus that would promote health and wellness. So in terms of how I can give you some evidence why it might be a good idea, for the testing and results, there were 58 colleges from 30 states. All U.S. regions were participating in the survey. We had 50% were in urban settings, 12% were majority African-American serving institutions, 6% were majority Hispanic Latino serving institutions, where 66% were majority Caucasian population on the campus. We found on average, most campuses had about 15, and I'm sorry, that standard deviation is missing now. I'll have to add that in so you can see it later. We had about 15.5 policies that were present on campus. The two that were most frequently there were offering the healthy fruits and vegetables and whole grain products, and available free water. The least frequently in place policies were regarding healthy beverage availability. There were 17 schools that had no policies for programming, 6 schools that had no policies for physical activity. 1 school had all 15 of the food policies, and 1 school had all 7 physical activity policies. Now you still may be saying, so what? Well, we conducted a linear regression just using BMI as a canary, I guess, or an indicator of health. It's not the end all be all at all, but it is an indicator that we can use that does speak to risk health for chronic diseases. So we wanted to look to see if there was a relationship between, and remember, this is just a snapshot, it's not causal. Other research would need to be done to see if it's causal, to look between the number of recommendations met and the average BMI of the students. And we know that as the number of recommendations met went up, the BMI of the students decreased. And so the recommendations that were most associated with having that lower BMI effect were offering more physical activity opportunities, implementing a wellness service learning program, having policies supporting bicycles and pedestrians, providing access to a registered dietitian and nutritionist, and I swear I didn't touch the data, offering a bicycle share program. So again, as you think about if you have limited resources on your campus, or if you want to do an intervention where you might see an effect and you want some foundation for what you're choosing to do, here are some opportunities that you might want to test or think about testing. I'm a visual person, so I just wanted to show you this kind of in a heat map, so to speak. So if you look here, the red are BMIs for obesity, indicating the students were more obese, if you see the red on the far right side, and then the green being the food, and the blue being the physical activity, and the black being policies. And so you can see as there's more color toward the bottom of the graph for those food, physical activity, and diet and policies, that you're going to see there's less red, so that you can kind of visually see that relationship between having more policies and having students with less obesity. So in conclusion, college campuses around the U.S. vary in the type and the frequency of policies to promote health and wellness. And we do know that meeting more of those recommendations was associated with a healthier average weight for the student body. And that needs to be investigated to find out if that's if there's actually could be a causal component there, or to understand why that association exists. And campuses that want to promote health for students may benefit from following those PHA-HCI recommendations. And they also can help campuses potentially prioritize where to allocate resources. And I will stop sharing. And if you have any questions, I believe we'll take them at the end of this session. So I will turn off my camera.
Great, thank you, Dr. Colby. I was just going to say there's no questions that I see in the chat. I did have a question about your first presentation, if you considered the applicability of some of those questions to all schools or if that was I might have missed it. But I was thinking about things like bikeability for maybe like schools in a city, or some of those resource options like registered dietitians, and having all of those organized physical activity options for like smaller schools, and things like that, if you considered that at all.
Right. And we can definitely do some additional analysis on the data that was already collected, and we could definitely look for more in the future. But what we have so far, since we do have a pretty nice, diverse group of schools that participated in that process, and we did not see that they differed by size of school or type of school or geographic location. So that was very interesting to me that those were not the predictive factors of which policies and programs were available.
Okay, thanks.
Yeah.